Good afternoon, everyone. Welcome to the Young Community Physicians Forum, coordinated by the Academic Subcommittee of the College of Community Physicians of Sri Lanka. I'm Professor Nuwan Wickramasinghe, a professor in community medicine attached to the Rajaratnam University of Sri Lanka, and I will be moderating this particular webinar today. And we have selected a very interesting topic for this webinar, which is on developing leadership in global public health from trainee to changemaker. Before starting the webinar, let me just go through a few important messages in relation to housekeeping. We will be video recording this particular webinar. Therefore, we kindly request all our participants to mute their microphones as well as switch off their video so that we would have minimal interference during the presentation. And we expect to have a lot of questions from you all. So please feel free to send us messages via the chat function. And also you can ask any questions directly after we finish the presentation by the speaker. And as you are aware, and as mentioned in our flyer, this program is accredited by the Education, Training and Research Unit of the Ministry of Health, and you will be awarded 1.5 CPD points upon completion. So we will be sharing a Google form during the webinar. Please kindly fill your details so that you will get the CPD points as well as a certificate. As mentioned earlier, the topic for today's webinar is developing leadership in global public health from trainee to changemaker. When we talk about developing leadership in global public health, it is extremely essential for our public health trainees in Sri Lanka because it helps them to acquire the skills which are needed to address complex health issues, not only at the local level, but regional as well as in the global context. And this approach is very important to enhance their understanding of the global health systems as well as policies. And also it would help them to prepare themselves for the real world challenges. As we all know in Sri Lanka, the public health training focuses on building expertise through intensive theoretical learning, as well as providing opportunities for them on hands-on experience. However, the public health landscape in Sri Lanka is unique. Therefore, to make an impact on the global public health field, our trainees must cultivate the leadership skills that could effectively navigate the unique challenges that they would come across in different health contexts. Therefore, we expect by strengthening these leadership abilities, they can tackle local, regional, as well as global health issues more efficiently and also to contribute meaningfully to the public health advancements in the global context. So to talk about this particular topic, which is very interesting, on developing leadership in global public health from trainee to changemaker, our speaker today is Dr. Archisman Mahaputra. And it's my extreme pleasure to introduce my very good friend, Dr. Archis. And first and foremost, on behalf of the College of Community Physicians, I would like to thank for joining with us today. I know how extremely busy you are these days, but despite your busy schedule, thank you very much for joining with us. So ladies and gentlemen, let me quickly introduce Dr. Archisman. Dr. Archisman Mahaputra is an accomplished public health expert with extensive experience in designing and managing large-scale, multi-site epidemiological and public health research projects. His expertise spans across multiple partner networks and a wide range of funding sources, including government agencies, donors, NGOs, as well as development partners. Dr. Mohapatra is also closely involved with health tech startups, providing strategic support for their initiatives. At present, he is the Executive Director of the Generating Research Insights for Development, or GRID Council, which is a pan-India non-profit network focused on evidence synthesis, knowledge management, and training. Dr. Archisman's academic journey includes an MBBS from SCB Medical College in Cuttack, and an MD in Community Medicine from Banaras Hindu University. He furthered his leadership skills with the General Management Program from Indian Institute of Management. A well-published researcher, he has contributed to numerous collaborative projects, particularly from a health policy and systems research perspective. His rich background includes work in policy translation and having contributed to drafting key guidelines and frameworks such as the Government of India's COVID-19 standard operating procedures, and also public sector biotech industry guidelines. Dr. Mohapatra has also played a pivotal role in the national research priority setting exercise in India. His roles as an epidemiologist and a social scientist with a very strong background in grantsmanship have enabled him to secure and lead numerous prestigious research and academic assignments both within India and outside. He has led over 50 projects as principal investigator, working with various stakeholders to enhance public health outcomes. In addition to his professional pursuits, Dr. Mohapatra is actively involved in philanthropic activities with NGOs focused on community services and has experience in training students across multiple disciplines, including health, management, as well as social sciences. So without further ado, I hand over to my dear friend, Dr. Archisman, to go through his presentation on this very important and interesting topic. Over to you.
Thank you, Dr. Nuwan, for that kind introduction and for making me so comfortable to interact with our colleagues from Sri Lanka. I also thank the academic subcommittee of College of Community Physicians, the Young Community Physicians Forum, for having me for this interaction. Before I put my slides on sharing mode, I must thank each one of you for taking out time out of your busy schedules and committing to listen to whatever I would share over the next 1 hour, 1.5 hours. I would request you to be as interactive as possible. Let's make it a bi-directional learning experience. We could exchange our views on the chat window here by typing in, and later towards the end of this talk, we shall also have some interactions if possible, one-on-one. Now, before I get started, I would want to remind each of us that leadership is not just for our own individual good, but for the betterment of the society at large. That said, we should also be reminded that on Earth today there are about 8 billion people, and we are just one of them. How can we be the agent of change that would impact the lives of all others? So, proportionately, the ratio of our existence is next to zero. But in terms of impact, we must be the harbinger. It's also important to stay reminded that we have a commitment to ourselves and all those who have invested in us, our parents, our families, our teachers, our systems. Each of them has invested in us. So it's a responsibility for us to achieve our full potential and also create avenues where people who are associated with us feel empowered and also get excited to achieve their individual potentials. It should not be a situation that you are a part of a team or an organization and that organization does not achieve its full potential. It's a commitment and we'll keep that commitment. And to accomplish that commitment, there are certain strategies that we may consider adopting or adapting as per our context. Right. So with this background, let's go through the slides that I have. I'll be talking about it, but if you have any queries, keep me posted on the chat window. Now, this is a very interesting topic. It is a very thought-provoking topic for me when it comes to talking about developing leadership in global public health from trainee to changemaker. In India, I just wandered my way into this in 2018, 2017 as a trainee to one of the leadership programs that I only had co-designed with seniors in way back in 2014. So I had co-designed this program, was a part of the initial cohort that were rolled out, but was not quite convinced about leadership training. Still, I took it in 2017. Subsequently, in 2018, I got a chance to examine 47 highly accomplished public health researchers, biomedical researchers across India through a Wellcome Trust funded project. I also had a chance to interact with the deans of 44 institutes and also interact with 180 collaborators of these 47 leaders. That came out as a fantastic report. I'll share that report in my presentation also, but it was an eye-opening experience for me. It took two years of extensive reading on leadership, subsequently a commitment to undertake leadership training programs, and especially for young public health professionals in India. And this opportunity provided by Dr. Nuwan is of immense value to me because it expands my scope, my range to my fraternity colleagues from Sri Lanka as well. Now, this is one paper, and there are several papers on this which talk about uh, the imbalance between uh, HIC, high income country based researchers, policymakers, public health professionals, and their representation in global forums as compared to those belonging to low and middle income countries. And that sort of imbalance in the power structure creates an opportunity for colonization. And you'll find a lot of papers now these days talking about decolonizing global health. Previously, or maybe just a couple of months back, if you could reflect on this, global health would mean whatever health situations that exist in the global south and are avidly researched by researchers based out of global north. And accordingly, policy worldwide was driven. Now, we, based in the global south, must rise to the occasion and contribute actively to the global health decision making landscape and see eye to eye with researchers worldwide. This requires exceptional leadership skills and the opportunity to leverage whatever contextual strengths our individual communities and populations and countries provide. Now, before we jump into the discourse of leadership, let's also look at what public health uh, problems are. And this will give us some kind of understanding of what kind of skills we might want to inculcate within ourselves if we want to shine in public health in our country and at a global forum as well. So, any public health problem that we come across is actually a symptom. It's not the diagnosis. So for the clinician who is absolutely into patient care, if someone comes with malaria, then malaria is a diagnosis. Or tuberculosis, then tuberculosis is a diagnosis. But for public health, that's a symptom. Why do people get malaria? Why do people get tuberculosis? Why do people develop diabetes? Now we need to dig deeper, right? So every public health problem that we come across is actually a symptom, and there are deeper underlying issues that must be addressed. So defining the problem, clearly defining the problem gets tough many a times. And as we say, a problem well defined is half solved. And so that's the avenue where descriptive research would come in handy. But still, a good description of a problem is many times tough. And each problem seems to be very unique to its context, to its people, and whoever is managing it. And there is no fixed solution, and no solution is absolute in its own way. So there could be solutions that worked, solutions that didn't work, groups of interventions called as health packages that might have worked or not, or to various extents. And solutions many times are cross-cutting across the system. So it's not it's not a problem at the primary level, and neither is a solution focused at the primary level only. For example, if a mother if a pregnant woman is having problems and it's a referral chain, then there are issues at each level. And even if there is a referral happening on time, then initiation of treatment could be delayed. So there are various aspects, and these are working together as a machinery within the system. And these problems are never solved. So in India, we had a problem of very high maternal mortality. And what we identified is most women would go for home delivery and there would be unskilled birth attendants, and that would lead to complications and death. So we focused on moving them into institutions for delivery. So facility-based delivery, institutional delivery was promoted. But as soon as the institutional delivery rates went up, we found that the quality of care they received at the institution was at times not very convincing. So the focus shifted to quality of care. So each time you intervene, the shape of the problem changes and there is no finite stopping point. And these are multi-causal and of various scales and multi-sectorial. And they set it, they're not just limited to one particular organization or one particular stakeholder constituency, and they span across boundaries. Now, if this is the situation, and you imagine yourself as a public health professional, what kind of skills would you want to inculcate within yourself and be a best fit to this kind of a challenge? Now, if you look at A career in public health, a, a career, an expertise that is intended to solve wicked problems, cannot be very simple in itself. So, a complex career is what we should be prepared for when we are committing ourselves to public health or community medicine. Of course, there are no clear alternatives many a times. Many times you might feel that, okay, whatever I'm learning, is it actually solving a problem? Or should I learn more or diverse things? Where do I stop learning? Is it like one skill that I acquire and it is timeless, or my skill sets have a shelf life, or there is a skill decay if I don't practice? And if every problem is unique, do I need unique skills, or could I have cross cutting skills as a leader? And if each one is a symptom of another, which problem should I start solving first? So how do I prioritize? And if the shape keeps changing, should I be addressing each change format, or is there a way out in terms of partnership, in terms of collaborations, team building? And if I don't understand what solution would work, what skill should I actually acquire? Now, if this is a complexity of the problem, how do we approach a career in public health? How do we design a career? And I found this particular saying by Einstein quite befitting here. So he says that life is like riding a bicycle. To keep your balance, you must keep moving forward. So if you don't cycle, you'll fall. So you need to cycle and balance it out. So there will be hurdles and there will be challenges on the way, but we need to keep moving forward. If you look at the overall global public health leadership key competency inventory, these are some of the uh, competencies that will come up upfront. Like you ask anyone, and immediately you'll get this option. Uh, One, of course, is cross cultural uh, communication. Now, communication in all its shapes is very, very important, and that's what I have been increasingly realizing. It's not just about written communication, it is about verbal communication, it's about body languages, and the ability to understand what the other person is saying. So it's not just about communicating what you want to communicate, but also involves active listening. And you can choose to remember many things that the other person says, or you can also choose to selectively pay attention to key words and not offend the other person when you are talking. The other thing is systems thinking. Everything moves in as a system, and especially so if you're into global health. So there's a lot of other determinants to your effectiveness, and that needs to be respected. And it must also be realized that health per se, even if it looks very important to us as medicos, is not as important a portfolio for the politico. For politics, it's about economics, it's about finances. And within those limited resources, each sector is competing with one another to get a major chunk of that resource. Health is one such sector which has advocacy and persuasive power, but not clear cut impact to demonstrate, and no fixed solutions that things will work. Of course, we've had vaccines and all, cost effectiveness has been established, but otherwise, it's been really tough for public health people to convince finance people to keep ourselves well funded in a sustained way. Now, adaptive problem solving in terms of resilience and adaptability. Now, this I have particularly taken from McKinsey. It's a survey that McKinsey did with global leaders across the world, from the corporate world, and they said that the future workforce has to be resilient and adaptable. Resilient means you have, like you're shooting a basketball into a net, and you keep trying till you actually put the ball in the net. So you keep doing the same thing over and over again till you win. But adaptability is like you need not keep on repeating what you have done, but you adapt your ways so that you succeed. So it's a delicate balance between when you have to be resilient. So a community is not accepting vaccines, you keep going to that community, keep informing them, addressing vaccine hesitancy and all. But if it is not, then you need to adapt your ways, you need to innovate. So it's a delicate balance of these two abilities, and have a deep understanding of equity and social justice. Clearly, we will not shine on a global forum if you're not including equity and social justice in your principles. Now, if you look at personal levels, what kind of foundation do we need? So it's interdisciplinary learning, understanding global health frameworks, and developing technical and soft skills. Let me elaborate this a bit. And this contrasts us from role modeling. Each of us would have looked up to someone and might have felt that, okay, this person inspires me and I want to be like him or her. Now, how do I become someone else? And will I be true to myself if I'm trying to become someone else? And what kind of competitive advantage or barrier it creates for others not to be my clone? And that's if I am someone who is not unique and I'm easily clonable, then I will lose my competitive advantage. So how can I be that someone who inspires and at the same time cannot be easily replicated, but replicated as and when needed? That happens when you are playing to your strength areas. So my strengths are unique to me. It could be unique to some other people as well, but the denominator would be really less. Now, my strengths are unique to me, and I may be having three or four strengths. What if I combine those three, four strengths? Now, that will create a and kind of an equation and make it very, very specific. If I commit myself to interdisciplinary learning, I will be combining my strengths together and also the strengths of other disciplines. And that would create a unique expertise out of me. So, for example, I'm an epidemiologist who also understands data science, like AI/ML stuff. Or I'm a social scientist who does qualitative research but understands advanced modeling techniques. So, or could talk about economics or could talk about business financing, business strategy. So, if you merge two disciplines and have core understanding of one discipline and also parallel understanding of other disciplines, it will be interdisciplinary learning, and that's important. The other one is understanding global health frameworks. So these are like the sustainable development goals and other frameworks that have existed. And those are like building on the wisdom of crowds. So these are consensus statements and consensus frameworks. And we at least stay within that vocabulary and not go grossly overboard in one go. So trying to be strategic in what we are saying and understanding things what has already been understood by others. So getting that common vocabulary. Now, developing technical and soft skills. This has been criticized many times in leadership literature that skills can't really be partitioned into hard and soft skills. And but for the sake of simplicity, we keep them as technical and soft skills. So technical skills are your know-how of like your discipline-based skills, and soft skills are your behavioral skills or interpersonal skills. Both are important. So if you think just by virtue of technical skills one would shine, yes, one would shine, but the level of accomplishment will be limited. By virtue of soft skills, would someone shine? Yes. If someone has just very average technical skills but exceptional soft skills, his or her accomplishment will be much more than the person who has just technical skills. And it's historically evident. So Copernicus also said that it seems that it's not the sun that goes around the earth, earth goes around the sun. And he was immediately taken into the king's court as a major minister and quite celebrated. 100 years later, Galileo also said that, but in a way that offended the king, and he was banished. So you can have technical skills, but also needful soft skills that will take you places. Now, this is key. This is very important. Relationships. Uh, do we mandatorily need a mentor? No, not necessary. Do we need just one mentor? No, you can have and should have actually multiple mentors. Do leaders make great mentors? No, there are ample literature, and Harvard Business Review talks about it, that leaders need not always make great mentors. So leaders and mentors could be different. Is mentor choosing a mentor and choosing a role model the same? No. Role modeling could be someone who inspires you. You can think of aspiring, you can aspire to capture some of his or her attributes, but your mentor is the one who guides you through that process of accomplishing whatever you want, and also in choosing or conditioning your opportunities. Building meaningful professional relationships. Now, how do you build meaningful professional relationships? So there's a fantastic book called Never Eat Alone, and in that book they talk about networking. And what they say is it's like a mathematical equation. So the number of people you meet multiplied by the number of things you do together with them. So it's not just meeting people, it's not just cold calls, it's about doing things that could take it further. So, for example, this one, I met Dr. Nuwan in one of the meetings last month, and it was just like me in that meeting. I met so many people met me. But with Dr. Nuwan, we spent substantial time understanding what he does, what I do, and interacting and matching our frequencies together. And then now we are having a presentation here. It definitely takes this professional relationship a bit further and will contribute to long-term networking. Now, leveraging international networks. We all have networks, but we confuse them as acquaintances. Acquaintances are good, fantastic, but converting those acquaintances into some kind of activity is tough. Many people fail in doing that. So if you have an international network, please keep it active. Invest in that network, invest your time, energy in that network, and definitely you'll get opportunities as you grow a bit more mature in your career. Now, in that study that I mentioned about, that was funded by Wellcome Trust, it was a study done in parallel in India and in Africa. This comes out from the Indian part of the study. We can't really go into a global public health landscape without collaborating. So, collaborating is important, but then the terms should be of equal partnership, where your collaborator and you have the same decision making capacity and share the same responsibility, accountability, and credibility. Why do people collaborate? So, there could be personal reasons, there could be professional reasons. Now, when it comes to profession, but let's look at personal reasons first, because these are again very unique to each of us. One is you have an interpersonal trusted relationship and you want to leverage that. So you have a very good friend and you know that that person is really good to work with and does meaningful work, and you want to leverage that relationship because that's an investment, that's a resource you have and you can capitalize. And also, if you have to answer like-minded questions, fantastic way to do that. You can also improve the quality of your publications. So the more lenses that are applied to any manuscript or any product that you make, the more acceptable it becomes. So if you are having multi-institutional, multinational authorship, your papers become very generalizable and high impact. And also it gets that kind of a dissemination scope as well. Uh, it's an opportunity to work with credible researchers. Many times we are locked up in some remote area of our country trying to do some meaningful work, but somewhere we are limited by our opportunities, right? So international networking or networking in general, collaborating in general will open up those responsibilities and will give you a sea of opportunities. They say, no, a fish will grow only as much as its aquarium. So you need to find your own ocean to grow big. Now, and you can also contribute to meaningful science and global good, and that is important. As we started, we need to achieve our full potential. We just don't need to do good to ourselves but to the society at large. We need to empower everyone. So for that, your collaborations are important. Now, for professional reasons, yes, it's complementarity of not just skills but resources. For example, if you are a public health researcher and you want to do multi-site study, you can't really keep moving around. You need to have good collaborators who would help you get that local footing, and also many times resources. So if I am a biomedical researcher or I am a molecular epidemiologist, genetic epidemiologist, then I might be having community access, but someone needs to provide me that microscope access or needs to do that bit at least. So it's complementarity, and it improves the quality of work and also gives the opportunity to do multi-centric studies, and then you become a part of global collaboration networks. So there are networks which write papers, there are networks which do brainstorming, the networks which just like are committed to advocacy. By being a part of those networks is profitable. You can, if you're a researcher, you can get too many publications, like real number of publications by just being a part of those networks and contributing to whatever extent you could. Like it's not needed that you contribute 100% to writing that paper, but at least whatever, a small cog in the wheel, that's okay. Now, mutual learning, it also enhances learning experience both ends. So it becomes co-learning as an experience. For example, for this particular talk, I've had many interactions with Dr. Nuwan, and it was a good co-learning experience for me. Now, what are the strategies we have? We can go attend workshops, conferences, online courses, there are research opportunities, and there are language and cultural competencies that I can gain by talking in those avenues. And we need to make the most of it. The more you expose yourself, the more you identify your strengths and weaknesses, and also the more you stand a chance to network. Now, there are these are again practical leadership skills that we need to inculcate. Project management. So you have to be very well managed. So managing yourself and managing your projects is of utmost importance in global health. That's a weak area for me, and I don't manage my time very well. But uh, I have also seen that people who have achieved a lot are usually constrained for time. But that's okay. But you need to be organized. Grant writing and resource mobilization is important. You need to be resourceful. You need to be very articulate in your communication, and you must have a problem solving attitude, not a problem identifying attitude, and have a very high threshold for any kind of ethics related issue. So you must be very ethical in your practice. Now, these are two documents that I'd suggest that you can have a look at. One is this INCLEN study report, the study that I have pulled out those uh, learnings from. And this one is a very good book for those who want to make it big in academia and want to move from that postdoc early trainee zone to an advanced faculty. You can download this book. These are available on the internet easily. Now, what are the key traits? It seems that there are some traits and some skills. So, traits are things that you're born with, and skills that you're acquiring. Leadership, they say, is a skill, or leadership skills can be learned. Yes and no. Uh, there are certain traits that you need to identify within yourselves, and accordingly build on those traits, and also acquire skills that are matching to those traits. So, persistence and innovation and curiosity, of course, that's needed in public health. You need to be competent, and you need to have good mentoring capacities. So either you can be a good mentee or you can be a good mentor, but if you are both fantastic, there has to be project management skills, and there has to be emotional intelligence, and especially team building and networking skills. In public health, you can't really be a solo worker. You have to work in teams. Now, when we looked at what really makes people achieve the most, if there are researchers, so this is about public health researcher, but I think this can be used for any leadership uh, role. And it seems that there is a technical bit, there is a personal management, and there is a network management, but also the institutional and societal research ecosystem that are important. So you must create conducive. So leaders are change environment. So if you put a leader in a situation, they immediately change their ecosystem in a way that actually becomes very conducive for their and their institutional growth. So your institutional ecosystem is important, and you take care of that ecosystem and also contribute to its betterment. Now, this is a we looked at how leaders evolve from trainee to leadership roles. And it seems that one of the ways of doing it is like one of the sure shot attribute that they have is they manage to take decisions with uncertain outcomes. So they are decision makers, especially when things look very uncertain. And how does it happen? It happens by being optimistic. Most leaders are very optimistic, and optimistic people look at positive outcomes. Mostly they see positive outcomes. And if you are optimistic and you are fairly convinced that the outcome would be positive, you tend to become a higher risk taker than playing safe. So by risk taking so optimism is associated with risk taking, and risk taking is associated with a higher reward ratio. So it's like being optimistic makes you more vulnerable to identify opportunities that can synergize and help you. If I had to reflect on how I got into global health assignments and to whatever success I managed, I found that it's more about teamwork, like having your own team. And I thank my team members for making me whatever I am. So you have a team and also collaborators, but remember that you should never ever burn the bridge. Don't burn your relationships. Even if you don't like them, you can just put them on pause, but don't burn that relationship. Always see that life is longitudinal and you'll build your cohort. So that's important. Your friend who is 30 years old at this stage, if you manage that relationship and that friend and you grow together to 60, you'll find that that person has become a director somewhere. You have also become a VC or a high power authority somewhere. And then the networks will be really, really powerful. And have integrity. That means you are predictable so that your people can trust on you, and be delivery oriented, and also a bit of personal branding. Now, this is a nice book, a fun filled book, and it says that success is a learnable skill. So, if you learn how to succeed, you'll succeed more and more. It's like that person in your class who comes rank one, and then so suddenly that person comes rank one, say in the fifth standard, sixth standard, and thereafter consistently gets good ranks. So success is a learnable skill, and you need to develop systems for that. But also know that when it comes to skills, it's quantity that often beats quality, but it has to be strategic. So it should not be that you are a student and you take up n number of trainings, like whatever online trainings are available, you just randomly invest your time and acquire that certificate. That's not going to add up on your CV. You have to be very strategic. What kind of skills you want to get, whether these skills are adding up, whether they are synergistic, whether they'll be compounding one another. Collect those kind of trainings, and the more you know, the more you can know. So I would say that's knowledge poverty. But if you have some amount of knowledge, that opens up more avenues of faster learning. It's like you learn how to read the English alphabet, and suddenly you one day you find yourself reading fantastic books, novels, and exceptional theories. But remember that we need to have a T-shaped, or even better, a pie-shaped expertise. That means broad understanding of various disciplines and deep understanding of one or two, at least two good disciplines, so that you can marry them and create interdisciplinarity. And then there are certain skills which make you shine in whichever role you get, whether it is public health or any other domain. It's like striking a conversation, trying to tell a story, interacting with a multidisciplinary public audience, even very good business writing, accounting skills, and adapting to technology. These are certain skills that you must acquire. I really find it very limiting when I see people struggling to type on the key on the computer, and you are into public health. Please acquire that skill, because all your life you'll have to type a lot. So why not speed that up? If you speed that up, you save a lot of time. You can do that reflexly, right? It's a learnable skill. Now, we as institution builders, at some point of time, will grow, and then we'll have to set up institutions or contribute to strengthening institutions. And there we must realize that there are certain hardwares of the system, the blue structures, and then there are the softer parts of the institution, that is the yellow structures. And also realize that the soft part is hard. So, how to set a culture of excellence, how to set a culture of success within your team gets challenging. But companies have done it, and they have done it by adapting to changes around them. So, what avenues should we take up? Of course, if you want to become a leader, then the 17 sustainable development goals clearly give you a direction, right? But these goals would change their names and would stay. We had the Millennium Development Goals, they moved on to Sustainable Development Goals, and after 2030, something else will happen. But these are broad directions where you can grow. If you want to have expertise, you can focus on one or maybe two, as much as your capacity is, but at least some, or even a sub goal or a target, whatever you want. You can take up these as your motivation. These challenges are here to stay. And as I said, these are wicked problems. So they will stay with us. Now, there are certain upcoming areas also. And the list that I provide here is not exhaustive. So there could be many other areas, but this is what I see. One is health policy and systems research, now implementation science, and trying to see how things work and why has become an area of interest. So we know evidence-based interventions, but they don't really work when we try to implement. Why and how to make them work? That's important. The other one is regulating things. So health governance, international health regulations, and health diplomacy. These are areas that are coming up. We might end up getting jobs in consulates also as public health professionals. The other one is health equity and social determinants of health. This again is has come up in a very big way. How do we plan interventions that protect the most vulnerable, and how do we advocate for that? Uh, the third one is technology. So point of care diagnostics, making our technological interventions human centered. So human centered design, data management in terms of data security, privacy, data sharing, open science, using big data to generate trends, so big data analytics, artificial intelligence and machine learning and their use in health financing, so universal health coverage and health insurance, these are also growing sectors. Information management and strategic communication. So during COVID-19, we all witnessed infodemics. So how do we manage misinformation, disinformation, and lack of information? And then there are certain issues that are being increasingly identified. For example, aging, gender, climate change and environmental health, mental health. These are coming up in a very big way. We must know that knowledge, but just by acquiring knowledge, we might not be able to bring in significant change. And there are processes involved. This is just a framework. And it starts with identifying problem, but also monitoring how knowledge is used. Now, that is again a chasm that public health needs to cross. Generations invest in generating knowledge, and then the next generation fails to leverage that. So many times we end up rediscovering the wheel in our own local contexts. So if it's a problem for us, then we should be open to seek feedback and help from friends around and adapt that knowledge to local context. Now, there are several barriers. At some point of time, we as community medicine experts would have to communicate knowledge to decision makers or convince decision makers to use that evidence. But there are barriers, and n number of barriers exist when we fail to convince policymakers to use evidence as the base for their decisions. And there are many barriers. Now, knowing all these barriers is important because accordingly, we'll use our skills of negotiation and advocacy, and if needed, activism as well. How do we integrate science? Here, read research as science. How do we integrate science and our understanding of community medicine into practice? So, we need to identify the barriers and we need to do a stakeholder mapping and accordingly tweak our skills to be as inclusive as possible and to onboard different stakeholder constituencies. And we also need to understand that there are multiple types of evidence in terms of quality and usability. And many times these are not generalizable. So we need to connect across levels. So again, that systems thinking perspective has to come in. And nothing works perfectly in public health, but we need to adapt and learn and keep moving. So the key trick is in learning. So the key skill that we need to acquire is to learn how to learn. So whatever you learn today will become obsolete. Public health is growing exponentially. It's a young science, it's a young discipline, and it is becoming increasingly complex. Over the last 20, 25 years, we've had five pandemics. So the challenges are changing each time. And there are pandemics like, of course, you have the flu pandemic, but we did have the HIV pandemic. And also, there are like non communicable conditions like hypertension, diabetes. Yesterday, I was listening to someone, and she said that in India, the study that they did, it seems that diabetes is the major etiological reason for hepatocellular carcinoma. So that hit me hard. It's not the viruses, it's not alcohol or anything. It's diabetes, it seems. So the complex interactions of disease conditions, uh, but a commitment to lifelong learning and learning things smartly. So don't try to boil the ocean. It cannot be that comprehensive a strategy ever in public health. You can't really know everything about everything. You have to strategize and stay very focused and identify your niche where you would be an expert. Now, these are learning systems. Again, a clarion call across the world, and there are different loops of learning. But with all that loop, whatever role you get into, these are some areas where you can uh, choose to work and increase your zone of influence. So, as a health policy maker, you can think of developing a learning strategy within the health system, a framework. As a program manager, you can have on the job mentoring opportunities and handholding supervisory avenues. As a community representative, or if you choose to start a non-profit or NGO, then you can think of participatory approaches and amplifying citizens' voice. And if you are a researcher or an academician, then you can think of doing meaningful work that could contribute to policy making or its implementation. Now, there are different programs to help you accomplish these skills. So, and I have very expansive list. You can easily find these lists if you search on the internet. And there are academic degree programs where you invest substantial time and resources to acquire a degree. Many times you have to go and stay in that university. And there are certain certification courses as well. And now there are online resources. So Coursera, EDX, these are also there. And also professional development programs, many times done with a management flavor. Uh, Non-profits also do leadership training, and these could be a bit heavier towards social entrepreneurship. And there are specialized regional programs as well, which focus on leadership within our contexts. And then there are intensive programs and very focused skill based programs for special purposes. And then research and academic leadership programs. Now, which program would I recommend? Uh, I don't have a recommendation per se, but then there is a fantastic program from Wellcome Trust, EMBO, and you can take up that program. Dr. Nuwan, just a couple, like a minute more, and I'll be done with it. Okay. So this could be a choice, and then there are emerging voices for global health and similar kind of programs you can choose. Now, what kind of program would I recommend? So no program is complete in itself. You can choose to have multiple programs and mix and match them according to your skill requirement, according to your career stage. Choose a program that you could complete end to start to end. Okay, don't drop out midway because most of these are impactful if done to completion. Choose programs which provide longitudinal support and mentorship, and you can also have programs if they have evaluated their impact so that you could make an informed decision. We published a paper, and this looked at 20 leadership programs in India that have been offered in the last 5 years. And this provides a laundry list of all the skills that these leadership programs train on. And then the gaps have also been identified. You can look at this paper and see if you want to create uh, a buffet of skills that you want in the leadership programs you might want to take. This is my team, and my whatever I share, whatever wisdom I've gained is heavily structured by these fantastic people in my life. So they span from communities to very powerful policy making boardrooms. Young people, they keep me on my feet, they keep driving me and keep me inspired. So thank you to all of them in absentia. And thank you to this fantastic audience, to this patient audience. We reiterate our commitment that we would do strategic learning so that we achieve our full potential and empower ourselves and the people around us. Thank you. Back to you, Dr. Nawam.
Thank you very much, Dr. Artisman, for that very intriguing as well as thought-provoking presentation. And at the beginning, I mentioned that this is a very interesting topic that we have discussed today about developing leadership in global public health from trainee to change maker. I would rather say it's not only interesting, but it's a very challenging topic. So we have done a very good thought-provoking presentation. So if there are anybody who would like to ask any question now, it is you can unmute yourself and ask questions directly, and we'll give you about 1 or 2 minutes for you to ask questions. If not, we have received several questions from our trainees actually in relation to different aspects that you have some of which you have already covered directly and some of which you have covered indirectly. But we will go through some of these important and interesting questions which were posted previously by our participants. But before that, if there's anybody who would like to ask anything with regard to this particular topic, or would like to give any comments in relation to this interesting presentation that Dr. Archisman has done, it's over to you.
I see that Dr. Dineshan has a question in the chat window. Do we have leadership certificate programs in Sri Lanka? Now, Dr. Dineshan, I can't really comment on this. I didn't search about specific programs in Sri Lanka, but I can have 1 or 2 quick inputs on this. One is you need not focus on leadership training in public health only. So this could be cross-cutting. Just, I would strongly insist that you do take up a training in leadership, especially if you are a mid-career professional. This will help you immensely. You can choose a business school to get into or an online program. Just see to it that there is some opportunity to build an alumni network, to do some hands-on case studies on leadership, and also, if needed, a longitudinal support for mentorship. These will be fantastic avenues. And you can also choose to read a couple of books on leadership. And the HBR collection, and the book title is On Leadership. And that's a good book to start with. Thank you. Can you explain hard and soft skills? Yes, Dr. Dhananja has sent me a direct message. Can you explain hard and soft skills? So thank you for that question. Now, hard skills seem to be those skills that you can learn while either by attending a structured training program, an academic program, or by working on clear-cut tangible deliverables. So these are technical skills basically. For example, you want to use a statistical test, you want to write a paper, these are hard skills. But the soft skills are the behavioral skills, the interpersonal skills. And even if people do provide a long list of soft skills, the most talked about soft skill is that of emotional intelligence. So it's about self awareness. So I know my own skills and strengths, and I know how I'm feeling at the moment. It's about self control, like trying to control your own behavior when you're talking to people. It's also about empathy. Empathy means understanding what the other person feels like, and using that understanding to channelize decision making in a way which is helpful to both of you. So that's a key leadership skill. So you might have, it's not about just saying, okay, I empathize with you, I really don't want to disturb you. It's not about being goody goody. It's about knowing the other person's emotions and managing that emotion in a very strategic way, so that you achieve your goal. So many times internally you may not be angry, but you might have to show anger, or internally you might not be happy, but you might have to say encouraging words. So try to manage those empathies, those relationships. The third one is communication. So how do you communicate? And I've spoken a lot about it, like written, verbal, non-verbal, or like speaking skills. And then the social skills. Social skills means behaving in an appropriate way within your own social context. In the global public health landscape, this gets a bit complicated. Right. You can read about Daniel Goleman's work on emotional intelligence.
So at the moment, we don't see any other questions that were posted during the presentation, but we have received several questions previously, as I told you, and we have tried to collate these different questions into different important topics. So some questions were about balancing personal and professional life. And there was a lot of questions in relation to the career progression and transition because we see a lot of public health trainees in our forum today. And some of them have actually asked about the measuring impact, the success as well as growth. And there were a lot of questions actually about emerging trends, challenges, and leadership preparation. And some of them have asked about mentorship, networking, as well as sustaining leadership. And some of them have asked about learning resources. So for most of these questions, actually, in your presentations, we have addressed these aspects. But I would like to start with this particular question on career progression and transition. So there are actually two similar questions. They were asking about what are the most effective strategies for transitioning from a trainee to a leadership position in global health?
Yeah.
You mentioned about
Uh,
this, but just the take-home messages, just to summarize what you have.
Yeah, so there is no particular way of doing it, but how I would suggest is, and these are my personal views, is like looking at yourself as your own personal secretary. So you need to be managed, and nobody can manage you better than yourself. So you know yourself in and out, right? And of course, there are blind spots, and you can take feedback and improve on that. But if you were to manage, suppose you were a celebrity, and suppose you were the secretary to a celebrity, how would you manage that person? So it's about managing the brand that you are. And that means behaving like one. You have to behave with utmost responsibility and accountability from a very young age. Be delivery oriented and be absolutely trustworthy. If you manage to do that from a young age, people will definitely start respecting you. And I must say that age is not a barrier. So you need not wait to turn 60 before you make an impact in global public health. You can be identified and picked up. There are people looking for talented people and committed people. So if you are in your 30s, if you're in your late 20s also, you'll be picked up into fantastic teams. But you need to behave very responsibly.
Thank you very much for that, Jisman. I think in your presentation, you mentioned this very important aspect of professional integrity. I really like that particular term, professional integrity, because we can define professional integrity in different ways, because it encompasses very important attributes or characteristics that not only a leader, but any healthcare or any other related professional should have. So for me, my personal take on that is actually, I look at the sincerity aspect of it, because most of these attributes that we talk about, this umbrella term of professional integrity, are actually interrelated, and this in the sincerity component is an integral component. So when we talk about, for me, I think sincerity is the sincerity that you have towards the work that you do. Whatever the work that you do, you have to do that with sincerity. In addition to that, whatever the moments that you spend with your colleagues or your other professionals, the moments and the interactions need to be sincere. And if you're sincere to your work, but I think, as you correctly pointed out, like your work would speak for yourself. You don't need any other recommendations. So the professional integrity is a very important aspect that you need to develop and build on from a very young age, I'd say.
Yeah,
Yeah.
I would like to add to it. You should not be too harsh on yourself either. So you do a sincere job, you make your best effort, but don't be self-punishing. I'm not following cricket of late, but I do know that Arjuna Ranatunga or Arvind De Silva is a fantastic batsman, right? Very sorted one. Or Sanath Jayasuriya, who was known for his fiery batting skills. Now, even those batsmen would go out for a duck at times, right? So it's okay. It's okay. If you're playing too many matches, there would be occasions where you would fail to deliver despite your best efforts. So just forgive yourself. In my career, I have taken up so many projects, but I've also failed to deliver in one or two projects. But it's you should reflect on that, why you failed, and try to avoid repetition of that mistake. So sincerity, as you rightly said, is important, but also resilience is also somewhere that needs to go hand
Yes,
in
of
hand.
course. Exactly. So when you talk about resilience, it's not only bouncing back, it's bouncing forward. We talk about identifying what has failed and why it has failed would help us to go a long way. Yes, thank you. So shall I take another question in relation to this career progression transition? And one participant has actually asked, any common mistakes that young trainees should be cautious or aware of in the initial stages of their career?
Uh, one mistake is there's a book called Your Ego is the Enemy. So when I reflect, when I did my completed my residency, I felt on top of the world, and I must say that I was very arrogant. And I felt that I have acquired all the cutting edge skills, and the world is waiting for me to arrive, and I'll be the change maker. With time, I've realized that it's a system. I should not call it as a midlife crisis, but it's a system, and many things that we aspire to do when we are young are not doable in this lifetime. Uh, so be patient, don't be arrogant, and don't uh, say no to opportunities which might look meaningless. So when you are starting out in your career, explore as many opportunities as possible, and try to see which opportunities appeal to your core areas of strength and interest. That's one thing. The other is like being irresponsible on social media. I would not say that you shun social media. You should be on social media, but don't write things which will stay over there and bite you back. Right? So, people might go back many years to see what you have posted ever, and then suddenly they find something that is very embarrassing to your current position. So be responsible, and don't offend people. Don't burn your bridges.
Yes, thank you very much. And there were some other questions also, as I mentioned. A lot of questions of these emerging trends, challenges, and leadership preparation. I think you have listed some of the important global public health issues, but I would take up this one question where they asked about what are the unique challenges faced by leaders or probable leaders in global public health, especially in the context of cross-cultural, resource-limited settings.
So one challenge is losing a lot of time because of lack of an orientation. Uh, in terms of academic achievement, if I was to reflect on my career, I also wasted much time preparing for entrance examinations, trying to crack through them, and there are faster ways of doing it. But I also understand that that kind of goal clarity does not come to us from LMICs. And when it does, we do not have the resources to latch on to them. Uh, what we could do is like at least connect with seniors and people who have seen uh, more of this world than what we have at this particular point, and they will be able to give us better informed tips to move forward.
Okay, so there were other questions actually similar to what I have just asked. And this particular question about mentorship, networking, and especially about the sustaining leadership. How to stay motivated and sustain leadership when facing crises, professional and global conflicts.
So again, a fantastic book by Machiavelli, The Prince. And what we need to do is like we look at leadership. So who am I as a leader? And most of these studies on leadership are actually oversampling of the dependent variable. So they look at people who are leaders and then try to see what skills they have. But they don't look at people who are not perceived as leaders and what skills they did not have, or they also had commonalities with leaders. So that kind of research is lacking. But what we want to know is it's a full-fledged skill inventory that you must have, and most of your leadership achievements are contextual. So acquire that full repository and use with prudence. You need to have people pleasing skills, and you also have need to have strong skills to say no as and when needed. Did I answer your question, or did I
Yes,
lose
yes,
track?
of course, of course. So add to that, I think in your presentation also you highlighted like we can't be complacent at any given point of our career, thinking that we have come to this particular stage and we can't have this ego thinking that we know everything, but that is not the case. We need to have this zest for continuous professional development, which is extremely important. Thank you.
You need
Okay.
to cycle to keep your balance.
Yes, of course. As you mentioned, yes. And the other questions were about the learning resources. I think we will be sharing this presentation, if I'm not mistaken, Dinishan. So we can share this presentation, especially the slides about these learning resources. So with the participants who wish to know about these things, please let us know. So we'll share this presentation, the specific slides. So any other questions at this moment?
So, there is one question there from Dr. Sonali
All right, okay.
in the chat window. So she's asking that any tips to improve skills on dealing with mentors from different disciplines, because I find it very challenging as an early career researcher, particularly when it comes to writing research articles. So, Dr. Sonali, this is not a challenge that is unique to you. I'm sure many of us have gone through similar experiences. Now, one thing is that I must compliment you if you have many mentors. Like why people are ready to mentor you should be reflected upon, and that could indicate that you have something in yourself which is attracting mentors. Now, the other one is if you see any skill is a sigmoid curve. So there will be the skill acquisition curve is sigmoid, right? So there will be an initial lag part, then there will be a log part, and then it will plateau. So once it is in log part, you will start enjoying it. So perhaps you are initiating and you are in that lag part, and that's why you're finding writing articles is tough. And then one day suddenly you'll sleep and you'll wake up and you'll find that okay, I can write research articles in and out, right? So that skill will come to you. You are in the learning process. So don't lose heart. Just open yourself to whatever inputs you're getting from mentors.
Okay, in the comment chat box, actually, we don't have any other messages. Are there any other messages which have sent to you directly, Dr. Achis?
No. There is a feedback form, and people can fill that out, please. Yeah.
Right, okay. So this is once again a small kind reminder to you all. If you want to get the certificate as well as to earn CPD points, please fill out the Google form that has been shared in this as a message in this chat box, so that at the end of the day, you will get the certificate as well as the CPD points. Right, okay. So we do not get any other questions at the moment. So at this juncture, once again, Achis,
Yeah.
I'm extremely thankful to you on behalf of the College of Community Physicians for taking your time off from your busy schedule. I know your team is somewhere today, but you had to stay in the office to do this presentation. So we really appreciate the commitment as well as the time that you have spent in preparing the presentation as well as answering these questions, because I think it's very thought-provoking as well as the saying goes, once mind is stretched by a new idea, it will never regain its original dimensions. I hope that you have managed to change dimensions of the young brains of almost all participants who are here today. So thank you very much once again. And we thank the participants who have joined with us as well as their very interesting questions. Thank you very much.
Thank you, Dr. Nuwan. Thank you, Dr. Dinesh and the team for helping out and for this fantastic audience. I just hope that at the end of this lecture, we feel more energized and motivated. Thank you.
Thank you very much. Thank you.